A very good evening, all. I'm Aditi Lamba with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from a studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 107 million cases of COVID-19 with nearly 2.5 million deaths. In the United States, we have surpassed 27 million coronavirus cases with at least 468,000 deaths. We continue to lose nearly 3,000 people a day with an average of 100,000 cases daily across the nation. States of California has surpassed New York, which was once the epicenter, with the most coronavirus deaths with more than 45,000 deaths. Public health experts fear that gatherings for the past weekend Super Bowl, as well as the arrival of the newly highly contagious variants of the coronavirus, may lead to another surge in cases before most Americans are vaccinated. On vaccine, there is an ongoing effort to push seniors 65 or older to get vaccine with the current slow rollout of the COVID-19 vaccines. This effort is to reach older individuals comes as the crowd continues to make up majority of COVID-19 deaths in the nation. More on vaccine, Johnson & Johnson CEO said that he thinks people will need an annual COVID-19 vaccine for many years to come. So as we all wait to be fully vaccinated, please remember the 3 key CDC guidelines of social distancing, hand washing, and wearing a mask. It's the most crucial right now. If you are a frontline healthcare worker, please connect with us on events@itvgold.com. In politics, the House impeachment managers presented their case against former President Trump and showed never before seen Capitol security footage. They have up to 16 hours spread over 2 days to convince GOP senators that the former president incited the Capitol. Quite a lot happening across the nation, so tonight we have more updates on the coronavirus pandemic and its impact. Here are the headlines. Dr. Tushar Patel discusses coronavirus updates and vaccine in New York City. Dr. Lieutenant Colonel Kamal Kalsi urges all to stay vigilant and follow CDC guidelines, New Jersey. Dr. Ibbad Yousuf on hospital emergency rooms and COVID-19 vaccine in New York City. It's time for a short break on Vision of Asia, Voice of the Community. We'll be back short time. Welcome back. I am Aditi Lama and this is Vision of Asia, Wednesday night episode of South Asian News. Let's take a look at coronavirus updates and measures. On vaccine, in an effort to speed up immunization campaign being counted to halt the pandemic, President Joe Biden has announced that his administration plans to increase the number of vaccine doses shipped to the U.S. states beginning February 15th. Part of the expanded supply will be sent to community health centers in an effort to improve vaccine access for mostly poorer and minority population those centers serve. So far, 33 million Americans have received at least 1 dose of COVID-19 vaccine to fight the coronavirus. Also on vaccine, the White House announced 3 new mass vaccination sites at sports stadiums in Texas that could deliver a total of 10,000 shots per day. The action comes days after National Football League said it was working with public health officials to allow use of its stadiums for mass vaccinations. Meanwhile, new variants of the virus are threatening another surge and concerning healthcare professionals and experts all across. Vaccines are now being tested against these variants. Bringing more insight into this, we spoke to Dr. Tushar Patel. What is your comment on double masking? Dr. Fauci has said that it just adds another protective layer perhaps to you. It hasn't been suggested by the CDC yet, but how are you looking at that?
So, masking, facial coverings are always good. There are not enough research for double masking. These are some of the strategies are given by the public health officials based on their experience of the virus. We all should follow that. And hopefully CDC guidance for the school openings and the masking will come up probably this week. This is what I'm hearing.
Right. Let's talk about the vaccines now, Doctor. You recently got your first dose of the vaccine as well. Share with us which vaccine have you gotten and how has the experience been for you and what are the side effects so far?
So I received my Pfizer vaccine last Wednesday. So last week I received my vaccine. After I received my vaccine in the evening, maybe after 10-12 hours, I started getting some muscle pain, some body aches, some fatigue, some lousy feeling for at least that overnight I experienced that. And next morning I took some over-the-counter Tylenol and some Motrin, and next morning I started feeling better. I had some soreness in my arm for 48 hours, which is normal. That is normal side effect from the viral vaccine. And I think overall, in my opinion, I think the vaccine was very safe and very effective. I did not get that many complications from the vaccine.
I'm hearing that the second dose, however, causes some more, not complications, but it has a bit more side effects. What could you tell us about that?
So the second dose can create that stimulus response to the immune system. And I think that is most common because now instead of 50-60% effective that vaccine, now it will become 95% effective. So it stimulates your immune system, and some people get sick for a day or two with some fever and some other symptoms. So that is normal in this kind of mRNA vaccine, and I would not discourage anyone from taking the vaccination.
Definitely. How was that experience personally for you, doctor? You know, you've been with us throughout this entire year, giving us so much information on COVID-19 and how to prevent it. How was that personally for you?
So at least I feel a little confident now in if I have to see someone, if I have to go in public places with my mask on, I feel a little confident that I will definitely protect myself. Even if I get sick, I will not get complicated disease course. So I think that is the good thing I'm looking at after getting my vaccine. But like I said before, we can't take our guards down. We have to follow the public health recommendations right now. And as we know that until we reach that 70-80% mark of people getting the vaccine in this country, developing the herd immunity, we are not off the hook yet.
Right. Let's talk about this Johnson & Johnson vaccine, doctor. We've heard it's only one dose, and they may get, again, the emergency authorization from the FDA. What more insight do you have into it? And also, one dose vaccine that could really change the rollout game.
Definitely, J&J vaccine one dose is going to be a huge game changer for this country, because I think that will not only is effective about 70-88% effective, but is one dose, the storage and other logistics is very much within the control of the local pharmacies or local healthcare system compared to what we are going through with Pfizer and Moderna vaccines, which requires the suboptimal temperatures. So I think J&J one dose is going to be a huge thing. One thing I would like to add regarding the vaccination is we are right now close to 60 million doses distributed to this country and only 43 million administered. So if we are going this rate daily from, and I'm hearing this last couple of weeks, we have 1.5 to 1.8 million doses are given. We require about 500 million doses. So if we go this route, we will have until at least end of July to reach 300 million people or 250 million people requires to get the vaccine. So we need to increase this current rate to 3 million per day to finish this by end of July.
What do you think the new administration could do right now, doctor? I know President Biden has promised 100 million vaccines, in his first 100 days, but what else could they do right now, according to you?
So ramping up the production, that's number one. We lack the national healthcare infrastructure. We don't have that in this country. And I think this is what we need, the resources, the personnel to give the vaccinations, the healthcare personnel, the nurses, the United States National Guard. And I think that is happening in few states already. But I think we need more. We need more vaccines, more availability in the local community. Local pharmacy needs to get this vaccine because they are the one knows their patient load, who are the patients at risk of medical disease. So those are the people needs to get the vaccine first, and the local pharmacy going to be the biggest resources for this effort.
More on coronavirus updates and measures. U.S. Food Drug Administration issues emergency use authorization for COVID-19 therapy from Eli Lilly recently, which combines two monoclonal antibody drugs, giving doctors another option to help high-risk patients. on vaccine after weeks of a slow rollout and distribution largely to hospitals, health systems, and local health departments. The COVID-19 vaccines will roll out this Friday at major pharmacies across the nation, including CVS and Walgreens. More on vaccine, Johnson & Johnson CEO said that people may need annual COVID-19 vaccinations over the next several years as the virus mutates. Johnson & Johnson has applied for an emergency use authorization from the FDA for a single-shot COVID-19 vaccine, and if approved, it could be a game changer in the vaccine rollout. So where are we headed from here? We have now a segment of our conversation with Dr. Lieutenant Colonel Kamal Kalsi on staying vigilant and fighting COVID fatigue while we wait for the most nation to be vaccinated. Here is Dr. Lieutenant Colonel Kamal Kalsi. Last year, the months of March, April, May were very, very, very awful for the north here. Are you seeing any of those trends coming in yet?
I think without a doubt we are going to see surges. Anytime there's a holiday or there's a spring break or summer kicks off again, I think people drop their guard, quite frankly, and Americans generally have shown that they are not very disciplined with regards to masks. And so I think we need a better, we need more buy-in from the regular American public in order to defeat this virus. We need everybody to be pulling in the same direction. We need to be wearing masks. We need a large percentage of the public vaccinated and quickly, because as you know, we're seeing all these different strains of COVID pop up all over the world, not just here in the U.S.
Right. And you just mentioned the COVID variants here. I'd like to discuss those. Could you give us an insight into these 3 COVID variants that we're hearing about in the United States, and also especially on the South African variant? South Africa had to pause its AstraZeneca vaccine rollout due to this variant. How much information do you have about its impact here in the U.S.?
I think all these variants are likely to be here already in a significant way. With air travel and movement, it's not that we're separate communities anymore. Really, the world is a single large community, and that's how we should be addressing this and fighting this pandemic. But to talk a little bit about the different variants, the preliminary data shows that the vaccine does seem to have some protection against some of these variants. Maybe the South African variant is a little bit more different, and so it appears that it may not be helped as much by the vaccine. But that's to be expected. The flu, for example, year after year mutates significantly. That's why we need the flu shot every year. And we will likely be with this coronavirus for years to come. This is not just a 1 to 2 year thing. You're looking at likely several years, if not longer. That will be fighting this. So we may end up needing a booster shot for COVID potentially every year. I don't know. We're not exactly there yet, but I think the more and more we sort of learn about this, it's to me it tells me that it's going to be with us for a while.
Right, and that's the biggest concern, right? Even after these vaccines, we don't know when we will go back to any sense of normalcy. Just on these, these COVID variants, experts are worried about the fact that it could reinfect people that have had COVID-19 infection before. Your comments?
Yeah, absolutely, and we've seen that already. I mean, I've had several cases of people that were infected in March and April last year, and they're coming back with another infection of COVID. So it's important that if you've been infected with COVID, that you understand that you still need to get the vaccine, that you still need to wear the mask, because One, regardless of your COVID antibody status, you may very likely get infected again with the same strain, if not a different strain. And we don't know yet exactly how long these COVID antibodies last. Some people say they last for maybe 4 to 6 months. Other people say that you have a little bit longer. So there's a lot of unknowns, and whenever you have a lot of unknowns, you have to be extra precautious. You have to be a little more aggressive in your preventive strategies.
Right, we must stay vigilant. I think that message we're getting from all doctors that we're discussing this with today. Just talking on the mask here, doctor, the CDC is suggesting that double masking could actually be very, very beneficial for all of us, adding another protective layer to our faces. How are you looking at double masking right now?
I think that makes a lot of sense, and at work, that's typically what we do. Right. I'll tell you, I wear the regular 3-ply surgical mask. I should have brought props. I wear the regular 3-ply surgical mask, and on top of that, I have my N95 mask. So, I think double masking does work, does help. For the regular public, having at a bare minimum the 3-ply surgical mask with some other mask on top, I think, is a good idea. That's what we do at home with my family. But just to wear, let's say, like a cloth face covering, or just the regular cloth masks, doesn't really give you much protection at all. So it's important to pair up those pretty or fancy masks that you can buy from the stores with at least a surgical mask or an N95 mask.
Right. It's now time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Aditi Lama, and this is Vision of Asia, South Asian News segment. We are looking tonight at several updates from COVID-19 measures and more. Today, the Centers for Disease Control and Prevention said that wearing a mask, any mask, reduces the risk of infection with coronavirus, but wearing a more tightly fitted surgical mask or layering a cloth mask on top of a surgical mask can vastly increase protections to the one wearing the mask and others around them. New research shows that transmission of the virus can be reduced up to 96.5% if both an infected individual and an uninfected individual wear tightly fitted surgical mask or a cloth and surgical mask combination. This comes during the time where President Joe Biden has challenged Americans to wear masks for the first 100 days of his presidency, and CDC Director Dr. Walensky stated that masks were especially crucial now given the concern about new variants circulating. So we hope you're all wearing your mask and protecting yourselves. On masks, emergency rooms, and more, we have now a segment of our conversation with Dr. Ibbad Yousuf. Here is Dr. Yousuf. I have some numbers coming in here. In the United States, we're at 27.2 million cases of COVID-19 with at least 468,000 deaths. In the world, we're at 107 million cases and more than 2 million deaths. My question to you is, how are you observing this number? And we keep on hearing that we're in a downward trajectory, but you're in the ER, you're in the front line. What are you seeing?
So here in New York City, at least where I am in Brooklyn, the numbers have been steady, slow and steady. Nothing has really peaked in New York the way we had that initial peak last March and April, which is almost a year from now. We are still seeing coronavirus COVID cases every single day. Overall, I think they're a little bit less severe coming through the ED. But still, there's a range of patients who are coming in either very sick or with just very mild symptoms. We're not as overwhelmed, I think, overall, as we were back during the peak about a year ago. So that's given us the time and space and ability to provide good care.
Right. And do you currently, and your hospital currently, have enough PPEs, ICU beds, and ventilators so far?
So yeah, comparatively speaking to the peak,
right.
Things have been pretty steady. So I think hospitals have been required to have a 3-month supply of PPE ready. So back during the lull we had in the summer, I know a lot of hospital systems, some of the larger and smaller systems, were basically buying up and collecting PPE with the anticipation that there might be a second full surge or even little bumps in the coronavirus cases occurring. So we have had PPE. It's not so much as an issue for us specifically, but I do know it is an issue throughout the country still for some hospitals who weren't able to get ahead of their peaks and their curves.
Exactly. And states such as California are still basically at their peak. Hospitals are super overwhelmed. As a person who experienced it firsthand, what's some advice that you'd like to give them?
The best advice is to just keep working. New York, the first peak, we were able to contain it. I do have some colleagues who were actually here with us in New York who are now in California, and they said it's very similar. I think California just surpassed New York in cases and deaths. Right. So it's just a matter of taking a day at a time and trying to get ahead of it. I know now we have leadership is acting differently from the state, local government levels and the federal government levels. We have had time to build processes in. So the hospitals are just working every day as hard as they can, and people are working every day as hard as they can. Just stick with it. New York is a good example of what can happen in getting major control over it, at least. So.
Today, the CDC basically suggested that double masking is, adding in another protective layer to your mask. It's beneficial. What are your comments? I would love to just get a little bit on that.
So right now we have good data that's showing that masking and double masking is working. I know a lot of that has to do with the physical nature, the mechanics of how a mask works. Often people don't realize the microscopic nature of how masks work. Often they're mesh systems. So naturally wearing two different systems of two different textiles or cloths or fabric or paper or cotton materials, whatever they're all made out of, adds an extra layer of protection. Similar to how an N95 is manufactured, it's manufactured in a more randomized pattern, basically, which is how it's able to provide the protection that it does.
Right, definitely. Let's now, Doctor, talk about the vaccines. I have a couple of questions about it. The first one is, I know you have gotten the vaccine yourself. Which one did you get? And, as somebody in the front line, how was that feeling for you? What were your emotions during that time period?
So I did get the vaccine. I got the Pfizer that became available to us first. I was actually the first individual to get it at my hospital system. So that was kind of exciting. It was a little nerve-wracking, I think, because such a new thing back in December when I got the first dose. I reacted pretty well to it. The first one, I just had a little bit of soreness on the arm where I got the shot. The second one, I had a few more side effects, a little bit of nausea, fatigue. It is not a live vaccine. It's an mRNA vaccine that uses the protein, the spike protein, to build immunity. So I knew it wasn't the actual, COVID coronavirus disease that I was feeling, but I did feel my immune system working as far as the reaction that happened. So that didn't feel good, but I was able to take some Tylenol, go to work, right, and have a pretty functional, successful day at work. So.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lambat. Take care and be well.